Well, for more on African traditional medicine, I'm joined by Maboe Mokgobi. He lectures in South Africa at the School of Health Sciences at Monash University. Thank you very much for joining us. What are some of the defining principles of African traditional medicine, and how do they actually compare to traditional Chinese medicine?
The traditional African medicine is holistic in its nature. And when you compare that to the traditional Chinese medicine, there are a lot of similarities between the two, because, as I said, both of them are holistic in nature. And when something is wrong in the body or even in the mind, they tend to treat in a holistic manner. So in other words, both of them, when somebody is sick, is presenting with psychotic illness, or is presenting with a physiological illness, it means the whole system is not well. So the approach is to treat the whole system, not just the one part of the body which seems to be sick. It's unlike the allopathic medicine, which treats the body like, I'm going to use this analogy, like a car mechanic. When a car mechanic looks at a car, they see different parts in the engine, for example, and when one part is defective, they would either replace that part or fix that part. When they fix that part, they use pharmacology, or they might use surgical means to replace that part. But in traditional medicine, just like in Chinese medicine, they tend to treat the whole system. As I said, it's very holistic.
Yeah,
so they are similar in that regard.
There is quite a difference between perhaps the medical treatment that you were to receive in a hospital, but those within the medical community have often criticized traditional medicine for its lack potentially of efficacy in most applications. How is African traditional medicine viewed? Do the doctors in Africa think that it's effective?
Well, based on research, and I can only speak about research, and the research has been done for many years, for many decades. There are many plant extracts that are used in traditional medicine, both in the traditional African medicine, in the Chinese medicine as well, that have been found to be very effective. In other words, those plant extracts are efficacious in terms of dealing with particular ailments. I can give you examples of such medications. Traditional healers have an effective medication for things such as depression. They have effective medication for things such as a urinary tract infection, particularly with the bacteria that is called Bilharzia. And it has been found that when somebody is presenting with urinary schistosomiasis, which is commonly called Bilharzia, when they use traditional medication in the form of herbs, that traditional medication, and this has been found and it has been tested scientifically by the scientists who were trained in medical universities. And this study was done in the 1970s. Some of the studies were done in the 1980s and 1990s and early 2000s, both here in South Africa, particularly in the area which is called the KwaZulu-Natal province of South Africa, and also in some areas in Zimbabwe and other Southern African states. This medication has been found to reduce to almost zero the number of bacteria that have infected somebody if they were inflicted by the bacteria called Bilharzia, what is commonly called the urinary schistosomiasis.
Okay, so there seems to be some research there pointing to some of the efficacy. Maboe Mokgobi there from Monash University.